Good afternoon, everyone. Nice to see you here. I'm actually now in Shanghai, visiting Shanghai University. So it's good to share with you my experience in this evening. I'm sure that many of you have already got a lot of experiences and may have a lot of ideas about yourself as well. So after the presentation, I hope that I can spend more time to discuss with you about your ideas, etc. So maybe perhaps I first share my screen and see whether there are any problems with my screen sharing. Um, now, are you able to see the screen, the PowerPoint? Is it okay that you see the PowerPoint clearly?
Yes.
Okay, perfect. So I'm going to Okay, so today I really love to share with you the virtual hospital. So my topic is about a time to revisit or a time to innovate. So why would I say this? Because virtual hospital has been here for a while. It was launched in 2019 when the COVID is here, but we actually have prepared the virtual hospital immersive experiential learning system for almost 2 years before it can really launch and make it materialize in our nursing school. So therefore, up till now is about 4 or 5 years already. So I just wonder, is it a time to revisit? Should we really move on and continue with what we've been doing? Or is it time to innovate and get on to with something else? So I really need you and your input to help us to understand whether it's a good direction, whether there's something new, some new input, etc. So the virtual hospital is a multi-patient management, multitask, and multi-fitful system. So why do I call this a multi-patient management, multitask, multi-pitfall system? I will explain to you a little bit more. But before I do that, I would like to really make some advertisement of what we have done. So as the introduction, Eva is very nice and kind, and the compliment to say that we have got the QS Reimagine Education Asian Gold Award that you, as some of you may already know, this is what we call an Oscar in education. This year, actually, every year they have the same conferences and they will select the awards for different tech categories. So this year, actually, I think there are 18 categories, and each category have over 800 competitors joining. And so being shortlisted is already very lucky, and we are humble. And at the same time, I hope I'm not too arrogant to say that is really nice that we can win the gold award for in Asia. And also in Hong Kong, we actually have got the ICT award from the government and in the smart education. Actually, if you are not really meeting the criteria, you will not have gold, silver, or bronze award. Actually, in my 2023 year, there were no bronze award and only the gold and the silver and the merits. That's the one that we have. Of course, we have also won some other local innovations, which are also very competitive, like the Social Innovation Award as well. And we have very lucky to get the 2023 the President Award in the Polytechnic University as well. So after all these really making you fly into the clouds, so I just wonder if it is already the time to step from virtual reality to reality and to review what exactly are we doing and whether what we do is worth it or not. So I really want to borrow Doctor Strange and really wanted to move on and go through with a little bit of the journey that we have. Um, Probably all of you may have got to the IMAX theater and or some other gaming place, and you may have played the technology, and you can really see the power for the last 2 decades. We've really changed such a lot in the game, the fun, the creativity, etc. And immersive virtual reality really play a really major role in the technology. Of course, the AI is coming and is really like a tsunami, right? Just moving on with overwhelmingly people going after the AI and developing AI related technology educations. So when we move on, are we really bringing the Hollywood, scenario back to the reality, like the Iron Man? Probably many of you like that, and I do. And is it really putting on a helmet and you can see a lot of different things, and you can really play around, and you can have the mixed reality, and you feel so thrilled when you are doing all this? So, let me ask you a question. Are you really feeling thrilled when you are having teaching learning activities, either as a student or as a teacher? So it's really worth it to stop a little bit to think about it. So is virtual reality is really something we wanted to go after when we wanted to move on with the technology assisted learning activities? Wow. You may want to really take a speed leap and say, okay, I am coming, virtual reality. So is it something that you really want to do? But wait a minute, not so fast, right? So you really wanted to think a little bit about, okay, the sum of money that you want to put in, the manpower and the time that you want to design and you want to incorporate and implement all these learning activities. So when we really want to sit down and think about it a little bit more, so you may want to take a look at the virtual reality continuum. All of you better probably definitely will know. So virtual reality is really manipulating your perception by hearing, smelling, feeling like the IMAX, of touch, you have tactile perception, sense of balance, your body sensation, you sense the temperature, or even sense the pain, etc. So all these can really mix and move into the virtual reality and make things really more real. But I would tell you one of the study, not from me, but from the literature, is saying that even you are not having all these visual perception manipulation, still it can be very immersive. But of course, we still need to think about, okay, what are the elements and components that we wanted to put in? For example, for this little framework here, there are four major types of immersive techniques and immersion level. So you can see that spatial immersion, are you really kind of stepping into the virtual reality? So cognitively, are you really immersing, thinking, sinking into what you are really looking at and what you really need to make decisions, etc.? And also emotionally, are you really immersed and have some feelings, really running, beating heart rate, etc.? So sensory motoric immersion is also something, do you really sense something, or do you really sensing something is moving, etc.? So it can be moving into virtual reality, augmented reality, and mixed reality. These terms really in some of the literature are overlapping and exchanging with one another, but there is still a little bit of the difference. But if you are in this field, you're probably kind of mixing this together and can put it into different types of virtual reality. Okay, so I really want to bring you, I don't know whether you have seen a bar over there. I have to move it away. Okay, anyway. So hope that is the little bar there is not blocking your view, but I wanted to say no. Okay, so this is the journey when I started to work in here. I would say the university, the PolyU, the SN School of Nursing is really very innovative. We have been the first in many things, definitely in technology. We have different types of technology and utilized in teaching. At that time, I was not really here. And after I came in, this very old, if you can see this publication, it was quite a while ago. And I think it's 2002. You can see that this is the intravenous cannulation. You will see this cannulation is using a real cannulation, but you are inserting the needle into some uh, virtual patients. Doesn't move. Okay, so this we call cat sim. You actually is looking into the screen, and with the screen, you will see the advancement of your intravenous canal, and then you will see that advancing it through, and ultimately, you will have the IV inserted to this patient. And of course, there are some published paper about that. So it was really the first thing that we have done and incorporated. So the success rate was found to be much better. And then later on, that we have a project not led by me, led by some of my colleagues. It's called a Second Life. At that time, it was very, very expensive. You will see that this is a screen-based virtual reality simulation for simulation training. So on my left side of the screen, you will see that there are some videos showing how to intubate the patient. So we incorporated this into the virtual environment. So you will see on my right side, you actually got into the virtual environment like an avatar and you try to intubate the patient. So at that time, I think it was really crude and it's really primitive. You really don't have much interaction at that time. And also the images are so primitive that when you want to put on the gloves before you intubate, you actually can see your hands really penetrating the glove, and you can see the glove is like a broken glove and you are really not wearing it, but the glove is overlapping on your hand a bit and not overlapping on your hand another bit. So it was not really that real, but we were using that to test whether people at that time are accepting this virtual reality as teaching. Because I myself, when I was teaching here, I think that why we spend so much money on the virtual reality and developing, spend so much time, and the actual learning outcome is not really that significant or magnificent. So I really was doubting that. But we actually got a paper talking about extending the technology acceptance model. It was cited by many other people after that. So we were exploring the intention to use this technology enhanced education, and this acceptance model really found that the student at that time is really accepting this model and the virtual reality teaching and learning. So that was one of the project that I was involved in. So therefore, when our team is starting to think about immersive virtual reality, of course, we have to find a lot of different literature and also existing commercial products and see whether they are really fantastic and is it really something that we want to go after. So look at this little slide here. You can see, maybe you have played this as well. You can see at the middle, there is the anatomy. So you can really remove the skin of the person, and then you remove the muscle of the person, and then directly go into the heart, and then you can study the anatomy. You can turn, you can flip around, etc. So it was really fun. But I don't know, it could be a very good way. And then the procedural skills, as you can see in this, also virtually, you try to intubate a patient. You can see this more sophisticated than the Second Life that we have used. So on my right lower hand, you can see that this is like a hive or a cave. You can see that on the wall, you actually interact. You can showcase, or you can show the scenario, what is going on, the ECG, etc. So the student can learn together in this cave. Then definitely there is exploding number of commercial products about single patient management like this one. So you actually can select different scenarios, whether it's COPD, whether it's heart attack, whether it's something else, and you can select one and then you can see how you manage the patient, whether the patient is deteriorating, improving. And lately, I think there are a lot of AI assessment, so the patient actually can talk to you, so that you can ask and they can reply, and then you finally can come up with a diagnosis. So I would think that they are pretty similar, but again, these are single patient management. These are very, very good. But I would ask another question. How many single patient management would you like to explore or try to play before you really think that you are good at that? So also in your curriculum, do you have so much time and so much learning space to include each and every one of the single patient management in the topic, in the subject? So therefore, of course, these are all very good. But when we move on, I can just buy these commercial products and use it and incorporate this in our system, in our School of Nursing. But team think is not really that. And we also look at the systematic review and meta-analysis. So this is one of the paper that we reviewed, and Professor Justina Liu and our team actually have published a paper on that. And we found that there are definitely some positive outcomes of the IVR, but most of them are on procedural skills, some of them are on theoretical knowledge, and some of them are on some other learning experiences. But with all these, I would think so if it's a procedural skill, so of course I have to make the disclaimer. All of the teaching learning activities, it cannot replace the clinical placement, the realistic practice that you have. But how do we prepare the students better? So procedural skills, would I use the conventional lab practice, which is cheaper, and there are hands-on skills, psychomotor practice, etc., and practice make perfect? Would that be even better than trying to have IVR for practices? So also high fidelity simulations. I'm sure that all of you may have experienced this as well. And there are large scale research talking about using high fidelity simulation to replace actually clinical placements. And there is a large scale research, and the findings found that the learning outcome doesn't seem to be very impressive at all. But of course, it will definitely prepare the students. But again, it's single patient management. And another thing is usually it coupled with the teaching content. So if I taught COPD, so this high fidelity simulation will probably also is about the high fidelity simulation as well. So is pretty similar, but of course, with the single patient management with high fidelity simulation, we may need to have to do it with the students in groups. So they will play together with different weakness, and then they move on, and then they have discussions. So finally, we would think, okay, so what else? If we are using IVR, what kind of content should we put in? So what are the hardware that are required? Do we really need IVR, or should we just buy some low fidelity simulation or high fidelity simulation, and then we can already fulfill the learning outcomes? So, but if we really definitely wanted to go with the IVR, so what's the merit of using IVR? The pedagogy, when we're using it, is it really fitting what we are planning to do? So earlier on, I did say about multi-challenges. So in the clinical practice, it's always not something linear, not something that are one-to-one, not one patient single management. So it's about managing different patients at the same time. So therefore, earlier I said it's multi-patient. So the scenario must be multi-patient. So this is one of the things we're very sure of. So secondly, so we review that there are a lot of clinical risks and errors. So you will see that in a lot of different reports, it come up with medication error. It come up with miscommunication of the clinical information. It also comes up with delay in care and responses, which it is one of the major area that we really wanted to polish our students, because the communication skill of the Generation Z and now it's Generation Alpha again, right? So their communication is not really something really impressive again. So patient falls are also one of the four major problems that we found in those reports. So if you wanted to do that, and not only in Hong Kong, but in overseas, the figures are pretty similar. So if we wanted to do a multi-patient scenario, should we use a multi-high fidelity patients? Or we can hire some actors to do some role plays? I will tell you that actually in one of the simulation, I actually divided the students into three groups. So perhaps when group one is doing the high fidelity simulation, group two is the observer, and group three actually will be doing role play of other patients, banging the table, okay, calling the nurses to come over, beeping the alarms, etc. So at the same time, that group of students, they did not even know that they will encounter this when they were doing the high fidelity simulation. It was pretty fun, but again, the quality may not be that good. And at the same time, we did not really prepare the students well to do the role play. So but if we are hiring all the actors to do everything, the cost effectiveness is really, really high. The cost is really high. So it may not be that really effective. So if we are doing the multi-patient management, so when we deploy it, So how can we do this? Actually, another team of our school staff have been doing a simulation work, also hiring the role plays from the actors and also from the family members and the students. So they really like it very much. But then again, is a lot very resource intensive. So, therefore, at this time, when we look at the objectives of the virtual hospital, we really are sure that we wanted the students to know the student awareness, situation awareness, and also the decision making, the time pressure management if they have to manage different patients at the same time, and the communication skills. So therefore, if this is the right direction, we created several scenarios. The first one actually combined the free scenarios before the student go into the clinical. They have no clinical or very minimal clinical experience at that time. Then they will have to simulate the clinical practicum orientation and managing multi tasks at the same time, and they have to prevent some errors that may be occurring. So with this starting, then they will go into the system. And the second direction is about creating the clinical pitfalls that I mentioned earlier. So look at this. For example, if patient one, bed one, in the meal menu, it should be nothing per oral. But however, if you look at bed one, the patient actually, the signage on the bedside actually show that the patient required to have Glucerna, one of the milk formula that has to be fed for this patient, fed through the NG tube. So if there are some discrepancy like this, so what will you do? So how would you really confirm what should you do to, these are some decision making to prevent some clinical pitfalls that might occur and causing error. So the other one is about the non-specific health issues. So early on, I mentioned about the high fidelity simulation, which could be very linear and it goes with the subjects that have taught that particular topic. But this one, we were talking about non-specific. So therefore, when you can see and on my right-hand corner, upper corner, you will see potential heart attack. So this one, the patient actually have some signs and symptoms that are very similar to a heart attack, but may or may not be necessarily be heart attack. So the student have to be very cautious. If a patient admitted for heart attack, they sometimes may jump into the conclusion. Jumping into conclusion is one of the very common mistake making situation, and they will say that this patient signs and symptoms is really related to heart attack, but usually it may not be. So the other one is going from the single profession to interprofessional context, and it's also a peer-led learning opportunities. For this particular scenario, we have two different disciplines, the radiography students and also the nursing students going into the same simulation together, and they have to peer report a case in a clinical round to the mentor. So at the same time, of course, the radiography students looking at for example, the CT scan, the angiography, so they will have to report it and also to align it with the patient's situation, looking at the patient's condition. And they have to teach our nursing students about some more about the diagnosis with the imaging, etc. And our nursing students actually will do Glasgow Coma scale. So you will see that this little white dot over here with this yellow line, actually you will have to apply a pain stimulus. So or you may need to look at the muscle power of the patient. So after they have done that, and they have to report to the mentor and again to teach the other radiography student as well. So the finding, how should it combine and how should it really help with diagnosing the patients? So it was really fun, but at the same time, of course, we have a lot of barriers as well. I'll share with you later if you are interested. So this one is from a first person as a patient. So you will see that the student actually log in as a patient. So he or she is lying in bed, just seeing his or her own feet. But then suddenly something changed. My left side, you will see the shadow of a little hand that's moving around. So the simulating the patient have delirium. So these older adults, our students are actually very young. So if they looking at this, they really don't know that something like this would happen. Actually, I myself, and I was working in a medical ward when I first started nursing. So I really hated the patients yelling all the time and calling pushing the call bell and asking the nurses to go over. Actually, there were nothing. But then I really didn't know that the patient have delirium or something need or some other needs. So my empathy level was really, really low at that time. But with this system, the student actually can really try and really think and experience and feel as if they were this patient, and then they may really increase the empathy level. So there is something coming over you like the spider. Actually, I know exactly what is going on, but when I was really playing this IVR game, it was really real. I feel that the spider really is coming over me. So I was really startled at the time when I was playing that. So I think it's really, really fun. And it's really immersed in the environment. So at the very beginning, we actually have done a scale called the presence questionnaire, and the fidelity of the spatial. Earlier on, I mentioned about the spatial, the emotional, the cognitive, and the sensory actually came out when we have the debriefing with the students. They were feeling so thrilled when the alarm were beeping and going off, and they feel that they really have to complete some of the tasks that are not finished, and they need to multitask and distract at some of the time. So the student actually tell everything about the objectives that we intended to do. So we were so thrilled, and therefore we built up so many different scenarios later on. So I wanted to introduce this feature here. So look at this. This is about a voice recording. So you look at, this is one of the design that I really wanted to introduce to you. So when the student log into the system and they play, the patient or the mentor or the staff in the ward will talk to you, and the student have to respond. But they have to respond and actually have to log in and start recording, and there is a little mic popping up, and they have to record what they wanted to respond to the patient. This is, I didn't know that this have such an impact to the students, because many of them say that they didn't know that they have to really say something to the patient. And when they really know that they have to say something because they may be the observer watching the other playing, they don't know when it's their turn. They don't know that what to say. They don't know what they needed to do. So they feel that they really have to polish their communication skills as well. And I asked them, you have high fidelity simulation. How come you didn't know that you have to talk to the patient? And they said, because some of the students, they may be some introverts, okay? They may just hide behind those active patients, students, and they may not have the chance or may not really need it to talk to the patient. But with this, you are the only one putting on the headset, and you are the only one that has to be recorded. So therefore, they feel that is an imperative that they have to do something about it. So they really feel that they need to do it. And after they've done it, they know that the skill is not really that good. They really need to polish it. So then after the recording, they stop, and we have already recorded this and put this in the backend data. And we can let the students listen to it again if they wanted to. And then afterwards, the multiple choice questions will pop out. So the student actually have a chance to do some multiple choice question, and the observers at the time some of the time they will be really tense, and they will actually tell the student, the player, what the correct answer should be. And in the debriefing, the students told us that in the multiple choice questions, it actually really stimulated them to think and reconsider and reflect. So this is something that I learned from them, that when I designed the game, I did not realize that it has such an effect. I just wanted the student not to arbitrarily just select any of the options without really thinking. So therefore, I wanted to ask them to record so that I can hear what they speak, what they say, and see what their thinking line is like when they are really speaking. But then the unexpected effect is that they say is really helping them to reconsider, because the choices is something that the options is something that they have never thought about. And talking about this multiple choice questions, also wanted to tell you all this multiple choice question come up in a randomized manner, and the options also come up in a randomized manner. So even with the same question, the options may be different. So therefore, it at least keep it a little bit, have some freshness when the other students are playing the same game. So also some of the actions and implementation actually are also different. So therefore they may, if I see another students doing this, they may see that the bed rails are not raised, but the other time it could be something else that happened. So this time maybe the call bell is ringing, the other time could be the cardiac monitors that are ringing. So this one is showing you that we have staff and also students playing at the same time. So you can see the student at the center and the other observers are really looking and trying to give some input as well. I wanted to say the pedagogy, we actually is using a gaming approach. So therefore, when they get a star and completed one of the scenario and move on to the second one, then they will have some sense of accomplishments. And also, um, when they are doing this together, they feel that the confidence actually increases. So the other thing is about whether it's the right direction is also about the scenarios. Now, actually, you can see that we have seven. At the very beginning, we have six. The seventh one is not really the formal one. We have trial run that one. It's the four risks. But you will see that there are three levels of the design. So the first level is about the simple to complex. So at the very beginning is the students playing the clinical practicum orientation, and they will move around the ward and try to get familiarized with the setting. And then sometimes the alarm is beeping, or they may come across, for example, the cardiac monitor. They actually don't know how to really deal with some cardiac monitors going off. So therefore, they may have to think, and at this time, they may have to decide. Or if the patient is climbing out, doing some risky thing, so do they know how to really assess the patient? This is the scenario that they have to do. For the multitasks, they really need to weigh which is the priority and why it is the priority. And also prevention of errors when they're doing something, there may be some distractions. So how are they going to deal with that? Okay, so I have come across actually this morning when we are doing this in with the Shanghai University staff, when they see a patient really falling in front of them when they are distributing the medication, actually they did not really pay attention to the patients. So I think it's really fun when we are saying that, when we see that. So the second line is about the single profession to interprofession, as I earlier said. It could be non-linear, it could be only potential heart attack, not definitely the heart attack line of thinking. The neurological assessment I just told you about the radiography students going in. And the forest of the students is with the physiotherapy students. So they have one metaverse online game doing very similar thing and the forest game at the same time in parallel, and compare the two and see which one have a better learning outcome and results. And the final one is from the professional perspective to the patient perspective. So this is typically what we have done. And this one is we call the multiplayer version. So after the single player version and the multiplayer version, but this one, the multiplayers is two students actually lock in together and then play the game together. On my right hand upper top, you see VMFY6J. That actually is the login password. So students, when they are observers, they can really scan a QR code and then log in with this password, and then they can do the MCQs together with their own smartphone. So while the other two players, when they log in, they actually can see one another when they are inside the avatar, the virtual reality space. So after I introduce that, so should we move on or should we revisit? Should we become innovate more? So of course, there are always room to innovate more depending on how much money you have or the time that you can spend. But we can look at some of the evidence-driven momentum that we have. As I said, the students' encouragement really, really enlightened us a lot and really is the momentum that caused it moving on. And we can see that they are very highly satisfied. When we first launched it, they thought it's really stimulating. They thought it really realistic. They were thrilled when they're moving on and they make decisions and they need to be very aware of the situations and communication interactions, etc. And we've done that across sectional survey and they find the findings like that one. And of course, we will go with the mixed method with a debriefing discussion. And we found that the VR training system actually influence their learning, influences their learning experience. So you can see that they become really highly alert and feel very, very nervous about that. So they feel that it's a highly stressed environment. So emotionally, they are really feeling the presence. And the potential heart attack is my other colleague actually have done another waitlist control, and he have done the comparison of the virtual hospital and the high fidelity simulation. And he was studying the soft skill of the students, actually the situation awareness, decision making, and self-reported communication and interaction score is really higher in the IVR system implementation. So also some focus group also tell you that they feel that the tension and urgency, and they know they needed to prioritize, and we use the clinical reasoning cycle to help them to move forward and making decisions. So also for the team-based one, we also collected some data about the team-based learning impact. And again, the clinical reasoning ability using this team-based learning impact is really good, and they were highly satisfied, and the quality of learning is really good. That's what they reported. So the older adults, we have published another paper regarding the empathy level, which was really, really lifted up. So this is briefly saying that the empathy, there's high satisfaction and high self-confidence. Actually, we have another paper in print. It's about the IVR with the forest, with the physiotherapy students and nursing students. So here comes to what we in the crossroad. So should we move forward? What do you think? So I don't know whether you can give a like or you can give a thumbs down. So I don't know. What do you think if it were you? Do you really want to, after you have revisited what we have done, do you want to move on? I really wanted to say, apart from the students, our team to collaborate is really important because when we have a team collaborate together, we add in the physiotherapy, we add in the different nursing staff together, and we add in the radiography staff together. And lately, we have involved. We were planning to involve maybe some food nutrition science. I don't know. Maybe we can have some projects together. So but this is the process when we are adding more team members together. They have a lot of different ideas and they are really, really creative and really expanding. So we are really synergizing what we have been doing. So therefore, our team actually starting from 5, and then we have 6. These are all nursing team members that we have. And then we've got the awards and attracted other team members to want to join as well. And even they are not joining us, they have other creative ideas and moving on to do their own innovations. So I think it's really worth it, right? We wanted to get the feedback. It's very important because the Generation C, they are they have very, very little attention span and they feel really bored if you are using traditional method all the time. I wouldn't say traditional method is not good. They are good. They are really good. But adding something new can really inspire them to help the student move on. And student actually, when they are giving you feedback, they can give you some ideas to how to innovate even further. So I would say this process is really a win-win situation. So therefore, we move on. We actually have some other new ideas, and we are processing about that right now. So let me just to give a suspension in the ideas that we have. So if you really want to join together, of course we can collaborate as well. So knowledge transfer is important, and we have obtained the short-term pattern for in Hong Kong, and we actually have already granted the application for processing in the Chinese for the patent as well. So meanwhile, attracting them or the staff and you doing the projects, of course, are important, but the integration to the curriculum are most important. As you can see, the preclinical activities, we use the first three scenarios, and the others, we actually integrate them to the subject so that it will not be after the project, after you collected the outcome, after you have published, so everything is gone and vanished forever. So we don't want to do that. So we must persuade the staff that to incorporate them. So we need to include the staff to do this together. And we also wanted to do some multi-subject-based activities so that one immersive learning or some other learning can apply to the different area, different subjects. So of course, cost is important. But I would say when we innovate, when the technology become more and more popular, so the price, the payment, the fee actually become lowered. So the cost could become lowered and we have better products and we already started and have some of the experiences. We know what's the barrier, what works, what doesn't. So we are moving as the first of its kind and also the first one to pioneer in this area. So we have to really think out of the box and walk out of the wall and break out. And then we are stepping into another reality. So thank you, Dr. Strange. So you really help us to move on. And of course, we wanted to further find out the clinical learning outcomes. So the bridging of the gap about the learning in the campus and also really whether this will help them is really a long term because I believe that education is a long-term outcome, but this add up together one by one. So having some longitudinal follow-up and asking the student to review whether these activities can help them in the learning is important. I remember a long, long time ago, we have something called the problem-based learning. So at that time, the students really hate it because they have a lot of preparation to do. But after they graduated, they really thank us because they think that problem-based learning is actually something that they do every day. So therefore, when we innovate, really don't want to just look at the short-term outcome. We really wanted to look at the long-term outcome as well. So multi-site studies, of course, we are welcome and really wish to collaborate. So now I'm going to play this video that kind of confined some of the major projects and signature projects that we have done. So it's about 2 minutes. So I'm going to play this video, see whether you can watch it.
The Hong Kong Polytechnic University advances teaching excellence through technology-enhanced education, preparing students for future healthcare challenges. Our team's initiatives feature innovative learning solutions to increase student engagement and foster interprofessional collaboration. The Virtual Hospital, our award-winning immersive virtual reality system, provides realistic multi-patient scenarios that simulate complex hospital environments. It's garnered paid subscriptions from institutions, including Hong Kong's Hospital Authority. We are collaborating with them to co-design new scenarios and expand training across their organization. 2 mainland universities have also joined our research efforts. In partnership with PolyU's Industrial Centre, we are developing AI-powered virtual patients to enhance interactivity. Additionally, our 2025 Trust Building Challenges empower students to co-design and evaluate IVR scenarios alongside staff, strengthening their technology skills and leadership abilities. Another flagship innovation, VCare, is a metaverse-based online role-playing game that unites diverse healthcare students to collaboratively explore patient management, unrestricted by time or location. Furthermore, our team has developed an LLM-based instant feedback system, integrating large language models into course content and assessments for real-time and personalized feedback. Our success stems from a collaborative spirit and synergy that drives innovation across the university. Through technology-rich strategies, interprofessional collaboration, and student-staff co-creation, PolyU has established a thriving hub for teaching excellence.
So I think I have got over time. So I stop here and thank you